Hello, everyone, and thank you. I'm going to allow just a few minutes for people to log on, and we'll get started at 11:02 West Coast time, 2:02 East Coast time. Hey, welcome, and thank you for joining us for today's webinar focused on establishing community response models for college and university campuses. This webinar is brought to you through Unlocking Democracy, a partnership between the Council of State Governments Justice Center and Center for Policing Equity. My name is Melissa McKee. I'm a policy analyst at the CSG Justice Center, and I will be your moderator for today's webinar. Before we get started, let's define community response as we will be using it today. Community responder programs are mobile teams staffed by professionals such as social workers, peers, mediators, and behavioral health technicians who are sometimes paired with EMTs or paramedics. These teams provide a range of services, including immediate assistance to people experiencing behavioral health, that is, mental health and substance use crises, wellness checks, assistance with housing needs, and other low-level calls for service. We've witnessed the expansion of these models across the U.S. as communities are reimagining public safety. We have learned that this model is adaptable based on the needs of the community being served. Now, colleges and universities are applying this model to campus communities as an opportunity to offer students and faculty a new experience with and new expectations for public safety. In our time together, we're going to provide a brief overview of the work of CSG Justice Center and Center for Policing Equity. Next, we'll hear from Michelle Feldman, Director of Partnerships at Center for Policing Equity. And then she will walk you through the suite of resources offered through Unlocking Democracy. And then we will hear directly from the field of community response on and off campus through presentations by responders at OSU Assist on the Oregon State University campus and Amherst Cress in the college town of Amherst, Massachusetts. Then we will share some exciting opportunities to join upcoming Unlocking Democracy learning communities. And finally, we will allow time for questions and answers. The CSG Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association, serving state officials in all three branches of the government with policy and research expertise to develop strategies that increase public safety and strengthen communities. And our goals are to break the cycle of incarceration, to advance health, opportunity, and equity, and to use data to improve safety and justice. And the way that we do this is by bringing people together. With our singular ability to reach federal, state, and local leaders from all three branches of the government, we gather people from both sides of the aisle and across the country to foster collaboration. We drive the criminal justice field forward with original research. Our in-depth data analyses, coupled with extensive interviews of people on the front lines of the criminal justice system, inform improvements and spur national initiatives. We build momentum for policy change. We synthesize and contextualize data to help policymakers enact and implement major reforms that address criminal justice challenges, many of which intersect with other systems such as health, education, and housing. And we provide expert assistance. Our unrivaled on-the-ground training and assistance helps state and local agencies translate the latest research into policy and practice. I will now turn things over to Michelle Feldman, Director of Partnerships at Center for Policing Equity. Michelle?
Good afternoon, good morning. Thank you for being here today. It's great to be in community with you. Thank you, Melissa. I can give you a little overview about Center for Policing Equity. So we are an organization that is about 15 years old. We're a nonprofit and we work nationally. And how we started was that our two founders, one is a former Denver deputy police chief. One is an academic who currently runs the Yale Department of African American Studies. They worked together on a project that measured racial disparities in different areas of policing, different policies in the Denver Police Department. So it started as this one-off project, and then it's grown over the years. We've worked with over 60 agencies across the country to measure racial disparities in things like traffic stops and use of force, and then also provide policy change that could help them reduce those disparities. So really shedding a light on the issue. And just some of our policies that you could see on the screen, duty to intervene, ban on no-knock warrants, ban on chokeholds. These are some of the policies that would help departments implement. And unlocking democracy is kind of our next step as an organization, in our partnership with CSG. We're able to continue promoting alternatives to policing, continue to promote getting police out of situations and, getting a healing response. So we have the Unlocking Democracy program really has three components. It's learning communities, which is what Melissa's going to talk more about today, data connection, and the Elected Leaders Council. And the Elected Leaders Council, the learning communities are virtual learning communities. They're in 4 topics this year. So it's college campus crisis response, it's youth diversion, community response, and community violence intervention. And really what they do is bring together interdisciplinary teams from across the country to really take the next step in setting up alternatives programs to policing, and it brings different communities from all over. It's really a big part of geographical diversity to help share strategies, help some larger and smaller communities just really share knowledge and provides technical assistance. And then our data connection helps to measure and tell the story of these programs through data. So really it's evidence-led interventions and documenting the process and outcomes of programs, efforts, and how to effectively use data in storytelling. And then finally, we have our Elected Leaders Council. So we have elected officials from across the country, from the Lieutenant Governor of Colorado to, as you could see, my council member, Crystal Hudson in New York City. And they are brought together around different public safety alternative issues. The goal is to help them sustain that, to develop policy changes, enact them, and then help them sustain reforms. Now I'll turn it back to Melissa.
Thank you, Michelle. Now it gives me great pleasure to introduce Riemann Abakar and Ton Christians from OSU Assist. Riemann is a social worker from Canada with experience working in crisis intervention, community and disability services, child protection services, and immigrant and settlement services. Riemann is excited to be part of an interdisciplinary collaboration that addresses the diverse needs of students on campus. She believes that crisis response should be structured around respecting the dignity and worth of individuals and groups, responding in safe and inclusive manners, and advocating for barrier-free engagement in the university community. Han, whose pronouns are Z-zer, has experience working with college students and community members in crisis. Z is drawn to this work due to her personal experiences around mental health and acute crisis. Personal and professional experiences, excuse me. Z is excited about the opportunities that OSU Assist has to be intentional in its support of students and staff. Riemann and Tom.
Thank you so much, everyone. I'm Ton. Like Melissa said, I use easier pronouns. One of the OSU Assist team members, if we can advance the slide. We are at Oregon State University in Corvallis, Oregon. So we're about an hour and a half south of Portland and about 45 minutes north of Eugene, where University of Oregon is. So today I will be talking to you a little bit about the history and purpose of our program. So our program is just finishing up its first year of actively being available and responsive. We came from student voice and student request. A lot of those requests and a lot of that student voice was coming during the nationwide protests due to the passing of George Floyd, and also combining that with the ways that campus changed during COVID, as well as the fact that we had a specific, our police officers on campus were originally contracted out and we're going to start being a actual in-house police department. And so kind of all of those transition pieces came together to focus on how can we hear what students are saying, how can we be responsive of that, and how can we move forward in such a way that we have an alternative to folks engaging with the police. We really focus on providing the right resources at the right time. So we do in person or over the phone crisis response for folks. Vast majority of our calls are in person, and we work with our Department of Public Safety, our housing partners, our Sexual Assault Resource Center, working with student conduct, really a variety of our diversity offices on campus, anyone that might be able to provide support to our folks. We have connections and care for them. Additionally, we don't just respond to students. So it is anyone who is physically located on our campus. So that could be someone is coming to a football game and they have an experience that they need some support for. We could support them even if they're not a student, even if they're not directly affiliated to campus. If they're physically located on campus, then we will support them, which also means that sometimes we work with unhoused folks in our community that are not students or not interacting with the university system, but we still support them by getting them connection to the community organizations in our area. We, like mentioned in our bios, we're a multidisciplinary team. So there's 3 of us right now, soon to be 4. And we come from a variety of different backgrounds, from public health, social work, sexual assault, domestic violence, shelters experiences, child welfare, mental health training and experience. None of us are like full-time professional counselors or anything like that. So we do not have that credentialing. However, like we still are able to provide a lot of robust care for folks without that credentialing. Can we advance to the next slide? So we are a co-response and also solo response model. So there are some situations where it's only a police response. We are dispatched through our campus dispatch center, and they like we can hear anything that's happening across campus. We're on their radios with them, and there are things that is just the police. Like sometimes someone wants to report a theft, and the police will be the folks that take care of that. Versus co-response models where maybe there's someone who has been sexually assaulted and they want to have support in reporting that, and they want to be connected to that. That might be something where we co-respond, maybe as us as a primary responder, to kind of be that care, that compassion, that listening. And then if they want to make like a police report, we also have give them access to that, and we can be there with them through that experience. Other situations where it's just us might be a welfare check where there isn't any like threat of violence or harm. We will be the folks that go to that and just go, hey, like, how are you doing? Are you doing okay? We're just here to see if you needed any assistance. Someone was worried about you, and connecting with them. So there's situations where we respond by ourselves, situations where we respond together, and then situations where it's just the police response. As I mentioned, most of our calls are dispatched through campus dispatch. However, we do have a few key campus partners that do have direct access to us via our phones. So that adds another additional layer that some of the folks that we kind of shoulder tapped and intentionally did some more training with them do have direct access to us if that is necessary. And we'll go on to the next slide.
So our OSU Assist team may respond to a call for a person, and that could be a student, a faculty member, community member, as Ton mentioned earlier. We also respond to a call for a person who appears to be experiencing a crisis or emotional distress or extenuating circumstances on campus. Next slide, please. OSU Assist will not respond initially if there are reports of weapons on scene or access to weapons. We won't respond if there are reports of violence or there's immediate medical emergency. However, we could be dispatched and we will station out until the police or the Department of Public Safety clears the scene and deem it safe for us to come in, and we could co-response or take over, especially with domestic violence cases. Next slide, please. So during the 10 months of operating, we learned a lot of things from our community. We learned that our services are needed 7 days a week. So we are expanding comes fall. We also learned a lot from our students. This program was created because of students' voice and called for change, as Ton mentioned earlier. We also listened to students' feedback formally and informally. We conducted a few focus groups with students who were generous enough to share their honest feedback. We heard that students value our services. However, we needed to do more outreach to students. We also learned that we heard in casual conversation with students that we look like police officers, as at the beginning we used to wear a vest that made us look unapproachable as per a student's comment. We took that feedback seriously and we no longer wear a vest, which was a great success. We also looked into our calls history, which led us to expand our services. And as I said, coming fall, we will be operating 7 days a week. We also learned so many valuable lessons from our partnership with Department of Public Safety here on campus. We continue to work on being intentional about how we can utilize both teams to ensure the safety and well-being of our community. Next slide, please. So our team is, we are 4 responders. You've met today, Ton and I. Our 3rd responder is Javier, and we are in the process of hiring someone who's starting hopefully next week. Next slide, please. So our full operation hours, we are going to be expanding Monday to Sunday, and we are in operation from 1 p.m. to 1 a.m. Usually we work shifts in pairs. So Tan and I are one team, and Javier and the other responder is another team. We usually respond in pairs. If there are calls happening at the same time that requires us to split, we would split, and if needs be, we could have a member of public safety to accompany us in that call.
Yeah. Just a note, originally for the first year that we've been in service, we've only done Wednesday through Sunday from 1 p.m. to 1 a.m. They did a large kind of look at all the data of where were the calls coming in that could have been our team could have went to, and based that on what our service hours are and what days of the week we originally started on. So that's kind of why we keep saying we're expanding. That's where we're expanding from.
Thanks, John. Next slide, please.
So we've done a lot of different training to make sure that this team is able to respond as successfully as possible to folks that we're working with. So some of the things that we've done are trainings from our wealth of experiences. So talking about what knowledge do we bring that we can help share with one another. One, helped build our connections and understanding of each other, but also made sure that like our community of responders was able to connect with one another and ask questions about things that we have some more of expert advice. Additionally, we are certified advocates, so that was an additional 40-hour training. It made it so that we have an exemption to reporting Title IX violations. So if you work at a college campus, most employees are responsible to tell usually the Office of Equal Opportunity or the Office of Title IX if there is a gender-based violence situation that occurs. Due to this certification, we are able to have an exemption to that reporting status, which like really is supportive of students because they can tell us something without us having to say, okay, now we have to report this to a different entity. Multiple suicide intervention trainings. We just finished the Living Works Assist training, which is kind of a global gold standard training for suicide intervention. Trauma-informed care, which is we specifically do the Trauma-Informed Care Oregon, a huge organization here that connects folks and talks about how do we engage with people in a way that is trauma-informed, all the way from what do our forms look like, what are our questions look like, how are our processes connected, and so really having that as a foundational level. Also done a lot of trainings with mental illness and behavioral needs in college, working with our campus counselors to make sure that we are speaking a similar language when we connect with students. And then tours of everywhere on campus. We need to know the physical spaces of campus so that if we are responding to a situation there, that we can engage in that space. And it's not the first time we're there. So we did residence halls, we did all of the athletic facilities, academic buildings, we did all of the diversity and cultural centers that are available here. Really wanting to be in those spaces before it's a crisis so that people feel more comfortable having us around, as well as we just feel comfortable in those spaces. Additionally, did a lot of trainings with our Department of Public Safety. I think the things that have been most successful is doing case studies with them. So we came up with some different calls that are very realistic to what we might have experienced and what we might have respond to, and talk through, okay, who's going to those situations, what resources are we bringing, how are we navigating that, like who else are we bringing into this conversation, what are the limitations of each of our roles, and really helping to build those relationships and connections with our public safety folks, while also helping them understand where we fit into their larger understanding of campus public safety. Some of the trainings that we've done, connecting with our community mental health providers. So we have a community-based response team. So we connected with them to make sure, like, hey, like, we know that we're going to potentially be overlapping in folks that we're engaging with. How do we support one another and make sure that those handoffs that we do are warm? And then another one that we did is connections with our, or we're hoping to do more connections with our emergency services. So our EMTs, EMS, as well as the emergency department, because we will transport folks to the emergency department if that's something for a mental health crisis. And so wanting to get more into those spaces to make sure that those people that are working in the ED know who we are, know what we're doing, kind of how we can work together to support one another. And can we advance the next slide? Yeah, so that is kind of a quick overview about us. Our website is that OSU.assist. Otherwise, our email is osuassist@oregonstate.edu. And we would love, if we want to do questions right now, if somebody has anything quickly, we'd love to be able to answer some things.
I actually think that we're going to save questions until the end. However, we are using the Q&A function. So if folks have something now, they can enter that just so it doesn't lose so it doesn't get lost throughout the rest of the presentation. So thank you so much.
Absolutely. Thanks for having us.
I'm really grateful that you are doing this work, and I'm excited to see how it continues to unfold and grow in service to the OSU community. Next, we're going to hear from Catherine Newman, who's the implementation manager at Amherst Crest Department. Catherine, who goes by Kat, was born in the biggest little city in the world, Reno, Nevada. She completed her undergraduate studies at Mount Holyoke College, where she double majored in gender studies and Spanish. She also holds a master's of education in social justice education from the University of Massachusetts Amherst. Kat has worked in nonprofit and higher education for over a decade, specializing in youth development, community outreach, and peer-based model interventions. She has designed youth programs, trainings, and taught high school and college level courses on topics of gender, sexuality, and race-based dialogues. Kat has experience working with self-harm reduction, suicide prevention, and reducing high-risk drinking. Her passion and advocacy work examine the intersections of mental health diagnoses, LGBTQIA+ issues, access to education, employment, and housing, using trauma-informed, trauma-centered approaches. Kat created the Town of Amherst's COVID-19 Ambassador Program. Her local experience in higher education includes serving as UMass's Team Positive Presence and Walk This Way program coordinator in the off-campus student center, and being a well-being educator at Amherst College in the health education department. Kat loves to build from the ground up, whether it be teams, programs, or now departments, and is attracted to fast-paced, complex work that centers relationship building. She feels both excited and thankful to be working in support of the work of CRESS. Kat.
Thanks, Melissa, and thank you to the OSU folks. I just got really excited and jazzed all over again for this work, listening to you all, and just thank you for your good work. So I'm gonna just start a timer because I like to chat and I want to make sure to keep to my 15 minutes. So thank you all. As Melissa said, I go by Kat. I use she, her pronouns. I'm gonna have about 15 minutes with you all, and so I'd like to start by just kind of framing our time together. So I'd like to tell you a little bit about what CRESS is, which stands for the Community Responders for Equity, Safety, and Service, where we sit within our municipal government structure. I want to give you a little bit of background about Amherst because we're real far away from Oregon, and I know everyone's coming from different places here. And then I'd like to share with you briefly our mission statement so you can get a sense. There's a lot that actually resonated with OSU, but it's really interesting as this work is popping up, kind of what is iterated and reiterated in different ways, but still very similar. And then I'm going to briefly talk a little bit about some of our trainings to highlight both our non-municipal trainings as well as some of our municipal. And then there's a very specific example that I'm going to share with you all that relates specifically to colleges, which is the Blarney Blowout. If any of y'all don't know what that is, you would know if you're on the East probably. Everyone jokes that the water bottle I use could be one of the Borgs. So we're going to talk a little bit about that. And then I'd also like to just finish up by talking about why I think this work is so imperative for doing on college campuses. So if you could advance the next slide, please. So this is our department, as I said, Community Responders for Equity, Safety, and Service. We are a fairly new department as well, so similar to OSU. We're actually a week away from celebrating our kind of year in the field deployment date. So we are a new town department that was created. All of our folks were sworn in on July 5th of last year, alongside another new town department, our Diversity, Equity, and Inclusion department. Basically, folks were sworn in, and then they went into about 9 weeks of training. We extended it a week because everyone on our team got COVID and we had to do things remotely, which made it interesting. But in terms of sort of the context of where we sit, so we are a standalone department. That makes us unique in some ways. In certain models, you'll see sort of co-responses, or you'll see programs out of departments. And I think it's really important to state that we are a standalone department. Our responders are unionized, which also speaks to kind of the validity of these community responder programs, stepping up and standing alongside other first responders in the field. And so our structure, we have a 13-member town council. We have our town manager, and then we have our police chief, which houses our emergency communication center, our dispatch center, our fire chief, and our CREST director. So again, they're sort of on equal footing, if you will, in terms of our public safety branches. Could you advance the slide, please, Melissa? Thank you. So just to contextualize Amherst for you all, you'll also hear me talk a little bit about town-gown relationships, because that's very particular to Amherst. And so for those of you on the call who that might be new to, town refers to sort of municipal government happenings, and then gown refers to sort of the cap and gown, or the university garb, if you will. And as many of you being in higher ed are probably aware, that can sometimes create really beautiful collaborations and sometimes some really tricky, interesting connections as well with neighbors and things like that, that sometimes don't always realize they live in towns where there's 40,000 students and things like that when they moved in. And so a little bit about us. We have a population of about 40,000 folks. Our population essentially doubles when the colleges come back. So right now we're having move in tomorrow. So everyone's kind of bracing for the traffic flow change. And I already talked a little bit about the town council. We have a town manager for our government, and then just some other demographics. You know, we're a fairly white town. We're also a fairly aging town as well. So a large portion of our population is senior citizens, and then also college students make up a large portion and sort of drive a lot of the action in town, if you will. And I'm not going to, for time purposes, I'm not going to read these because I know this is all going to be available to folks. So I'll have you advance the next slide. So a little bit similar to what OSU folks had talked about. So CREST was created out of the murder of George Floyd and that reaction to that, and wanting to have a public safety response that was anti-racist. And so that is really baked into our mission statement. So we are an unarmed, person-centered, trauma-informed, anti-racist public safety agency. And when we talk about unarmed, we really mean that we mean that both in sort of the figurative sense of we will not carry pepper spray, we will not carry guns, things like that. But we also mean it more philosophically speaking. So all of the engagement with our department is consensual. So when our responders walk up to somebody, they'll say, "Hey, may I have a conversation with you?" If it's no, then they move on. They also you'll never see our responders section 12ing folks. You'll never see them issuing fines, citations, that sort of thing. That's really important to our work. Some of our core values connected to our mission statement, and in no particular order, we're anti-racist, as I said, we're unarmed, trauma-informed care is at the center of our work. We have an overarching sense of optimism, we're person-centered, and we're highly collaborative. Next slide, please. So what I wanted to do, and I'm happy for the purpose of this presentation, I'm not necessarily speaking about trainings. That's often a question that we get a lot of interest in, and I'm totally happy to connect with folks offline or in this session if there's specific questions that they have. But really, when we designed training for our folks, and as I said, it was about 9 weeks of it, we really pulled from both, and again, thinking about that town-gown relationship, right? We really pulled from both the municipal side as well as the higher ed side of the house, and also community side. So we brought in families and youth to do some of our trainings. We brought in our college and universities because how you're interacting with students is going to be potentially really different than how you're interacting with permanent residents or longtime residents, right? We also interacted with a lot of our government officials, and this bore fruit in kind of really interesting ways. So for example, we did trainings with our town clerk, and we now serve as constables at elections to help keep the peace. We did, our planning and conservation folks, because when we're out in the field and we're interacting with folks that are unhoused, we're going to know how to kind of where we might see them and how we can kind of support those folks, or our DPW folks, or things like that. And then our college partners have been really important, because as all of you may know, when students come to a campus, right, they don't often just stay on campus. And so having that opportunity to work with our different institutions and having them teach us certain things and having them be able to learn from us is really important. And to echo what the OSU folks had said, really it's about that kind of relationship building, and then also speaking a similar language. And so for our main modalities for our folks, we're trained in motivational interviewing when the conversation turns to suicide, voice hearing, nonviolent communication, and the piece that I wanted to mention about motivational interviewing is the person that actually trained all of our responders. Through part of our grant, we were able to support a variety of kind of different initiatives within the community. One of being that we were able to have that same trainer train a bunch of different folks within the community. So train shelter staff, to train library staff, to train some college staff, to train our local survival center working with folks navigating food insecurity. And that same language that people are speaking are really important, because there's going to be times where you can interact with somebody and have that kind of, to echo what OSU had already said, that kind of preemptive relationship building. But then there are times when you are going to see somebody in a moment of crisis, right? And so being able to all speak that same language, and I think just saying to folks like, you matter, we care about you, you're important, goes such a long way. So I'll have you skip to the next slide, please. So I really want to talk about Blarney Blowout. And so Blarney Blowout is something that unfortunately had us make national news back in 2014. And it was sort of initially this kind of perfect culmination of kind of showing the importance of having town-gown relationships, and sort of where breakdown in communication happened. It was initially an event that was kind of a bar promotion around spring break. And so now we kind of know when it's kind of happening, and we've worked with sort of our local restaurants and bars and liquor stores and things like that. But this was essentially a day where back in 2014, all the parking lots filled up at UMass, and all the dining halls ran out of food. And there were 3 officers that we had on duty. We have a fairly small police department. And then folks were kind of getting calls like, hey, there's something kind of happening. And there were thousands of students that had kind of come in town. It's a day where there's a lot of drinking happening. I remember my boss over at UMass, who'd been there for 25 plus years, and she said, I was never nervous to be on campus, and somebody called and said, hey, you got to get down here, something's going on. And students walked over the hood of her car. Cars were flipped over, things like that. If anyone wants to Google it, you can see lots of things. And that created what was called the Ed Davis report. So they came in and they sort of looked at kind of what broke down, how can you make it better? And so one of those things now is, the police department created a neighborhood liaison position. When I served at the off-campus student center, we did a lot of outreach with students and education around that day. And previously they had really had a ton of mutual aid that they would call in, sometimes around 250 officers from the surrounding area. Really, it was a day about crowd control. This also gets into, and again, I'm happy to talk with folks kind of offline about crime prevention through environmental design and active bystandership, but that's really at the core a lot of this work. And so looking at time, I realize I have 4 minutes left. So what I wanted to kind of highlight is the way that the CREST department was able to be plugged into Blarney this year. So the university has what's called the CCC, the Campus Community Coalition to Reduce High-Risk Drinking. There's a lot of different partners around that table that range from elected officials to landlords to citizens to public safety folks to folks from the university. And they were sort of, their aim is to reduce high-risk drinking and to keep students safe, right? And so what are the kind of things that went into plan there? And so part of what we did was we did what we call knock and talk. So we literally go around, we knock on folks' door, share information with them. And it's really, we want to be clear, it's not about policing student behavior. It's about saying like, hey, we know you're going to do these things. Here are ways to stay safe around them, right? And so we had folks come in because the CREST department was new. We had folks from our police department, that's my service dog and the police chief, doing a training. We had folks from the off-campus student center come in and give kind of a contextual institutional history of it. And then we partnered with the off-campus student center and some of their student employees to go and do this outreach. The day of, we fielded all of our teams out, and actually the picture of the radio that you have here, one of the things that came out of this is our radios were able to be heard more clearly than some of the other police and fire radios because it was so busy in the EOCs. They're cellular and encrypted, and so that actually prompted our fire department to sort of kind of expedite getting those. Because we were a new department and we hadn't yet received our vehicles yet, the fire department allowed us to drive around in their fire van, which allowed us to kind of navigate spaces a little bit differently. We also chose to field an all-women's team that day, particularly for some of the intoxicated folks that we were kind of bumping into. And can you actually progress to the next slide? And so there's a couple of things that I want to highlight. Because we are a public safety department, we were actually able to be written into the ops plan for the Amherst Police Department. This gave us a lot of validity, if you will, in different ways, because while the town of Amherst understands that we are another public safety branch and folks are kind of getting used to hearing us, when you think about mutual aid, right? So when your college campus is kind of having a large scale event, who are the other partners, right? So the folks at OSU, they might be really well known within their public safety kind of places, but if they're pulling in other places, it's going to be really important that those community responders are kind of brought to the table in that way. So that's allowed us to kind of be in the kind of the welcome morning meetings. It allowed other officers in the area to know who we are, know what we look like. These are our uniforms. We always say we wear gray to kind of occupy an in-between space, but we're recognizable in that way. And I'll have you advance to the next slide. And so this one, what was really interesting about this event is normally it's a crowd control event. This year, because of the Borgs, they're known as blackout rage gallon jugs. And so it's about 1/5 of vodka mixed with kind of electrolytes or different things. I'm sure folks are aware in higher ed spaces where they've seen this. And so while it's often kind of initially touted as a harm reduction tactic, you're still drinking 1/5 of vodka. And so what we were seeing is really intoxicated folks, and it actually put an incredible strain on our emergency system in the sense that we had to call in MEMA, and we had to we had so many transports that we actually pulled ambulances from 7 surrounding towns. And so what CREST did was we were able to go and kind of help triage because the fire department was so busy and they also physically couldn't get to the next place. And so we were another kind of helping hand in that regard. And one thing that I really think about with this work is being, and I stole this from the fire chief, I know plagiarism in higher ed is a big thing, and so is really about being a force multiplier with having fidelity to your role, right? And so there was a way in this that we could still honor and do the work of CREST, but still support the safety and well-being of the students and the residents on campus. And I'll have you advance the next slide. And I'm also running out of time, so if you need me to, can I still go for 1 minute? Okay, thank you. So yeah, so I just want to I already said the fidelity to your role piece, and I can't kind of stress that enough, because I think what we'll start to see is when people start seeing these programs in these departments standing up, right, it's really about collective community care. And like, if you lead with kindness and you're caring for folks, right, like you kind of can't go wrong. And this allows everybody to kind of do that, but also do it in a way that you're all on the same page and you're all rowing in the same direction, I think, but rowing differently and honoring that difference, right? There's a ton of town gown benefits. So if there's folks that's a particular thing with your institutions, I'd be happy to kind of talk with folks offline a little bit more about that. And then I think, I think about when I was in higher ed spaces and what we hope for our students, right? And hope for our permanent residents, like we want to support their well-being and we want to see students succeed, right? And so this work at its core really fits into a lot of the mission statements, a lot of the strategic action plans of universities as well as towns. And again, I'm biased because I love this work, but like, again, I don't know that you could go wrong with this in many ways, right? we talk about a way to institutionalize kindness. And doing that work is a privilege, right? Getting to see somebody sometimes at their lowest, and also then being able to build that relationship and see them at their highs when they're doing really well and celebrating things, that is a gift, right? And so that's, I think, what keeps bringing us back, right? And then the other piece that I'll end on is really thinking about scalability, right? So when we were able to be a part of the learning community, I remember we're kind of a small fish, if you will. And I remember running out of my office door, knocking on my boss's door when I got to sit in and learn about Durham and some of these other really like phenomenal places that are much larger than us. And I was like, we built the same thing and we didn't know it. We built the same thing. Oh my gosh, like, one, we must be doing this okay. And two, like, this is incredible. And so I think there's two things here, right? Like, one is the scalability. So like, sometimes I think we get stuck by kind of paralysis by analysis, right? And like, what's the best practice and how do we do this? And so to some degree, if you just start and you just make the move, right? And I think OSU, you can probably think what you did on day one versus a year later, right? You learn so much, and then you can establish the best practices. And it's not that you're just doing it unintentionally or without thoughtfulness, right? Like, there's a way to do it, but just starting is a big piece. And then the other piece I'll say is that join the learning community. I cannot like stress that enough, because there were times when I was doing this work, whether it be thinking about uniforms and how to make that a collective democratic process for our folks, or building schedules, or how we decide to do the work, or things like that. And when we found the learning community, it felt like I felt like this work sometimes, because you're so focused doing it, or you become in this silo, right? And I think it can feel really lonely. And so it was like helpful to be like, oh my gosh, there's other people that are these like incredible, excuse my language, like badass people doing this incredible work, like all over the place internationally, and they're thinking about it really differently. And it allows you to think, this won't work for my community for these reasons, or, oh my gosh, I didn't think of this, and this is something we should do. The other piece that I would say that's so helpful about the learning community is people are so willing to engage with other people on this work, because we need other people, I think, right? Both to care for the folks that we're designing this work for, as well as making sure that we're bringing our whole selves to the work and caring for ourselves, and like just maintaining that good piece. So I'm way over my time, so I'm gonna mute myself. Sorry, Melissa. Oh, and if anyone would like to reach out to me, they're welcome to. We also love in-person visits. My service dog is sleeping below me right now. He didn't prop up the whole time, but he's not so good at emails, but he is a joy to see. So I'm biased.
Thank you so much, Kat. It has been an incredible privilege to work with and witness CRES over the past year, and your outro leads perfectly into the intro of the learning community opportunities that are coming. So this fall, Unlocking Democracy is launching its second year of learning communities focused on alternatives to policing in 4 subject areas: college campus community response, youth diversion efforts, community response, and community violence intervention. These learning communities provide opportunities for interdisciplinary teams to come together for peer-to-peer learning and to hear from experts in the field over the course of 10 months, with additional one-on-one support from CSG Justice Center and CPE staff throughout. There's no cost for participation. Please use the QR code to access the learning community landing page to learn more and apply. The field of college campus community response is rapidly emerging, and as such, this learning community environment is designed to assist programs to engage in process-oriented planning and program development. Interdisciplinary teams comprised of key stakeholders will learn with and from one another in sessions covering topics such as goal setting, using data to inform program design, community engagement, program staffing and workforce, and program sustainability. If you're on this call and your college or university is exploring campus community response as a means of ensuring more equitable and supportive public safety systems, this learning community is for you. The applications for the learning communities and the Elected Leaders Council are now open. Please share these opportunities with your networks. And next week, the CSG Justice Center, in partnership with CPE, is hosting a webinar focused on how alternative first responder models can support youth in crisis. So please do register and attend. I'm now eager to open the floor up for questions and answers for our fabulous presenters. I will check. I have none yet. Oh, here we go. I am curious about what evaluation of these co-response models look like or might look like. What sorts of data do you collect, and do you use data for internal planning purposes as well as external reporting? If both, who do you report to externally? I will hand that over to either OSU or Kat.
So what we do, lots of different data. So everything from when we go to a call situation, we take a lot of data about that, about who got to the location first, what resources that person was referred to, what some like base level demographics of those folks. We use Maxient for that, if folks are familiar with that system. We also look at, we have access to the Department of Public Safety call logs, and we review all of those logs to see, are there calls that we're missing? Are there calls that we missed because we just weren't dispatched to them? Are there calls that we missed because we weren't available at that time? And so like for expansion of the program, what are we looking for there? Also, we did surveys of our like campus partners that we interact with most often, to say like, what do you know about us? What do you need from us differently? Like, how can we support you? And how do we make sure that these relationships continue to grow? Also did some student focus groups and learning, like, do you know about us? Are we marketing in a way that makes sense to you all? Do we need to maybe change language and understanding? One of the things we learned is that the word crisis is not a word that students necessarily connect with, that they seem to think that like whatever they're experiencing is not bad enough. And so we're looking at different ways to communicate that we can still support them, even if they're not necessarily identifying what they're going through as a crisis. We do internal planning with that, and we also show it externally. So we are housed in our Dean of Students office. And so we show to like the Dean of Students, we show to our Department of Public Safety, our Sexual Assault Resource Center partners, all of the different partners that we work with on a regular basis. We report, we just did a year report to those folks. So really it's who we work with most often that's getting that sort of external reporting. So I hope that answers it for you.
And I'll hop in as well. So I'd echo the like lots and lots of data, and also the way that the data, what's interesting about this work is oftentimes the systems that are created don't easily capture a lot of this work. And so that makes the data, sometimes we're reporting or recording in multiple ways. And so for us, from our end, there's three main things that we're using. One is ESO. It's the same, it's a sort of a record management system. It's HIPAA compliant. It's the same system that our fire department uses, and we did that very intentionally. It has really strong analytics, and it also allows for on the back end to kind of click through and turn on and off certain things, because one of the things that we want to balance is sort of really thinking about a presence versus a policing, right? And so over collecting of data as well is an important thing to kind of keep in mind. And this allows to kind of looking at like our folks basically will fill things out in 3 systems. And so how do you get those systems to kind of work with one another? We're getting ready to be dispatched onto 911. So we come through IMC through a CAD system. And so we worked with our other public safety folks to identify. Right now we have 12 different call types that we've identified. Those range from anything from kind of an assist citizen, an assist business, assist police, a well-being check, a non-trespass, like non-vagrancy trespass, things like that. And then we also, when we started the work, because there weren't systems to capture it, we started using Microsoft Forms. And so we actually go as far as sort of perceived demographics of data, because also the systems often refer to census data. And so thinking about, I think it's really important to note and pay homage to the way that this work was brought about, right, which was reflection on the murder of George Floyd and thinking about racial justice and the ways in which the census data often flattens identities. And so we've really expanded a lot of our social identity data that we can kind of work with folks on. And we also collect anything from sort of like the weather to follow-up commitments and things like that, because that often can dictate what we're kind of seeing and why we're seeing it. And then the other piece that I'll add is that we also worked with the UMass Donahue Institute for evaluation purposes and to create kind of new systems. And we'll be moving into what's called Qualtrics as a system that allows us to kind of, they basically looked at our forms and allowed us to create kind of a different monster of a form that we can do all sorts of data with, but also be much more inclusive around that. And then we're funded, our responders' salary comes from the town operating budget, but we are funded in part largely through the Department of Public Health. That's also a whole other conversation around this work and getting us to be through the Department of Justice. But that funding we respond to, we also put in our yearly kind of budget narratives for our town, to our town council. We also have a community safety and social justice council that we often prepare reports for. And because we are public safety, we can be FOIA'd or public records requests can come through our office at any time. And it's used internally and externally as well. Hope that answers that.
Thank you so much. I think that does definitely answer. We've got another question here. It says, our university has just started a co-responder program this last May. We hired a licensed therapist in this role. I'm curious that the two models described today did not have licensed therapists in the roles. We've had a lot of conversations with campus lawyers, the privacy officer, and the district attorney around confidentiality and laws for both police and the counselor. The idea of going with a non-therapist would make communication a bit easier in some situations. What sort of educational backgrounds did you look to hire for, or did you look for or hire into these roles? That's a great question.
Would you, OSU, I just recognize I just talked a lot, so I didn't know if you I wanted to punt it to you first. Or,
we looked for really focusing on lived experiences that folks are bringing to the table. So we require a bachelor's degree. We do not require a master's degree. Our baseline is 3 years of related work. So that can be sexual assault, that can be suicide, that can be college administrator, like housing folks, that can be anyone that has kind of experience working in crisis. So we have social work, psychology, marriage and family counseling, like all of those different things that will lead to what can be trained into this role, because there are so many different trainings that you can do to kind of beef up whoever you bring in. So anything from, oh, this person's got a really great background in responding to sexual assault situations, but they might need a little bit of support responding to suicide. There's plenty of like different trainings that you can add on to kind of round out someone's personal experience. So like we said, it is the 3-year minimum. And then we looked at their understanding of like public safety systems. Have they worked with that before? Looked at their experience with marginalized folks. Like we wanted folks that could really be anti-racist or be on their way towards anti-racism, and wanted folks that had competency with LGBT folks and with disabled folks, and really valuing that, because that is harder to teach and harder to generate than some of those just skill-based things. Additionally, we have talked a lot about privacy and what that looks like. Because we are not confidential, we refer to ourselves as private, but there are different reporting expectations that we have. Like we're still mandated reporters for child abuse and elder abuse or neglect. But we were able to get the exemption, like I said, for Title IX. So like there are spaces where those things are available. We also do connect with our campus counselors, and like we've received some trainings from them to kind of make sure that we are supporting folks as best as we can. But it is really looking at lived experience that someone might have, work experience, volunteer experience, not necessarily making it have to be a professional academic background, because for a lot of those situations, like actually having done the work or actually having that lived experience can make responding to someone experiencing that very different than just having that clinical background. But yeah, I really appreciate the variety of understanding that we have, that we're not all coming from a strictly clinical, strictly potentially carceral background. And so wanting to make sure that that is a thing. Also, as Kat mentioned, they're a consent-based service. We are as much as we can be. If we are afraid for someone's safety or the safety of others, we are not able to do the consent-based service. But in any situation where there is no threat of safety, we are able to say like, hey, we're here to talk to you as long as you want us to talk to you. If you want us to leave, like we will absolutely do this. Here's a resource card. Have a great day. And so like also centering that, and can the people that you're hiring kind of step away from their ego to engage with those people and like value their consent and value their autonomy.
Thank you so much. We are just about out of time. I do want to just elevate that this is what we're hearing over and over and over in the field, that lived experience is really the most effective experience for fulfilling these roles. And so I would just ask, if you're on this call and you're doing this sort of work, to consider that. I will make these slides available to everyone who has attended. And so if you'd like to get in touch with the folks at OSU or Amherst, you will have that information. Thank you all for joining us. Thank you so much, Tom and Newman and Kat. It's been an absolute pleasure. I could sit here all day with you all and have this conversation, but being mindful of time, we will call it closed. So thank you. Please reach out if you have any questions going forward.
You all.
Thank you.
Thank you.